Hello, welcome to Nemours AI DuPont Hospital for Children. I'm Cynthia Zhang, the Pharmacy Director of Operations and Support Services. We are a 260 licensed bed children's hospital and the only Level 1 children's trauma center in the state of Delaware. We moved into our current pharmacy location at the end of 2018 with beautiful sweeping views of the Healing Garden. Next up, you'll meet other members of our pharmacy team. Please enjoy the tour.
Hi, I'm Adrienne Miller, Pharmacy Manager of Non-Sterile Operations at Nemours Alfred I. DuPont Hospital for Children. Right now, we're in the main pharmacy. In 2018, we built this beautiful new space and designed an open concept that enhances communication and line of sight. Over here, we have our pharmacists that are doing order verification and review. And over here, we have technician workspace and they're doing production, non-sterile. Now we're going to take a walk over to our huddle board. This is our huddle board. Every day at 8:30, our department meets here to talk about the issues for the day. It's here that we can escalate any issues that came up the day before, highlight any process changes, escalate any issues with equipment or supplies, and address any staffing challenges for the day. The good part about this board is that we are able to take the time to recognize any great catches made by staff or recognize associates for a job well done. To be compliant with USP 800, we designed a non-sterile hazardous drug room. In this room, it's negative pressure, and our associates don PPE to protect themselves from occupationally hazardous medication. And over in this area, we do all of our non-sterile compounding compliant with USP 795. All of our compounds have pre-built recipes and then are barcoded for added safety. This piece of technology is our tablet prepacker, where we take bulk bottles of medication and repackage them into unit dose quantities. The other machine is used for processing code trays and boxes. It easily helps us identify when we have recalls, and it can track lot and expiration via camera technology. And the last stop on our non-sterile tour is our delivery staging area. It is here that the medications are placed in bins and staged to go out on the next hourly delivery. We have hourly deliveries every day to all of our inpatient medication rooms, and also staff delivery technician that is there and readily available to deliver any medications to those patients when they need them.
Hello, my name is Zachary Klosevich. I am the clinical lead sterile pharmacist for AI DuPont Children's Hospital. And today we're going to discuss three major areas to provide the safest environment, the more efficient workflow, and even some high-level technology associated with barcode scanning and robotics throughout our sterile complex. I'm standing in this room here, which is a segregated staging area that enables technicians and pharmacists to appropriately organize supplies, clean supplies, and effectively move it into our large coiling pass-through to allow for continuous flow of activity within our sterile complex. So we have a centralized ante-room setting where individuals are able to gown, garb, and clean, and then access both our hazardous drug area as well as our non-hazardous drug area. The hazardous drug area is held separate, so it's enabled to maintain a complete state of containment for any hazardous residue, while the room itself is under complete negative pressure throughout all of operations. Each workstation within the IV complex has its own dedicated laptop and actual camera. The technician is able to use a barcode scanner that's connected to the laptop and scan each individual ingredient. They're able to take a picture of the ingredient that is used and the specific volume that is drawn up. This is saved and enables the pharmacist who is working in the IV room, also pharmacists that are outside of the IV room, to look, review, provide information and feedback to nursing or physicians who have questions regarding the status of a child's care. Our second piece of technology, which recently was introduced, is a robotic system that enables the unit to help compound, prepare the item, validate specific compounding steps, and barcodes individual ingredients to allow technicians more flexibility throughout the day for more complex issues and more complex preparations.
Hello, my name is Lisa Brown. I'm the research pharmacist for Nemours Hospital for Children in Wilmington, Delaware. This is where we do most of our work and store our drugs. We have over 60 oncology trials and around 35 sponsored trials. In here is where our postgraduate year one resident does the majority of her work. She has a beautiful panoramic view of the side of the Nemours estate. The The postgraduate year 1 pharmacist will be sharing this office space with 2 research pharmacists, Lisa Brown and Shadea Violet Tang.
Hi, my name is Carrie Weaver. I'm the administrative coordinator for the pharmacy. Here we are in our break room. We have stunning views of the Healing Garden. Most pharmacies are built in the basement, but we were lucky enough to get a beautiful spot next to it. We have windows all throughout our break room. We also have the capabilities to hold webinars in here. And of course, everybody needs coffee. We have a coffee, Keurig, water, and microwaves for our busy staff. Now let's go check out the pharmacy locker room. Everybody has assigned lockers. We also have 2 changing rooms with mirrors. And here we are at our pharmacy conference room. It's equipped with a PC, TV, WebEx for conference calls, and also offers our department an extra space if they need to work on their projects.
Hi, my name is Erin Hanley. I am the manager of clinical operations here at Nemours AI DuPont Hospital for Children. I oversee a team of clinical specialists. These are pharmacists who are specialized in various areas of patient care here at the hospital. They spend their time daily rounding, providing drug information, precepting students and the pharmacy resident, and they're located here in the clinical hallway as you see, and they share various pharmacy touchdowns. If you look inside, you'll see they each have their designated area of personal space.
Hello, my name is Elora Helmus. I'm one of the pediatric clinical specialists here at Alfred I. DuPont Hospital for Children, and I'm also the program director for our residency program. Today I wanted to show you some technology that we have to help us to get out on the floors and interact with the medical teams. And this is our workstation on wheels that allows us to put our laptop on and be mobile. And the next thing that I wanted to bring your attention to is this huddle room. And this is a general purpose room that is used for students, associates, and residents, and it's great for discussions.